Dr. Paskin, what about if an adult, for instance, or for that matter, not so adult, but anybody, he has one or two crooked teeth in front, and very often the solution is grind them down, stick some veneers on it, or as I call them, clip-on tooth nails, and very workable solution. Is there another solution also? I have heard there seems to be with a thing called Invisalign. Tell me about it.
Well, some patients will say, I have a little crowding of my lower teeth. This top tooth never used to overlap in the front. Now it does. I went to another dentist and they said I should just do all veneers and I'll make them all straight for you. Well, of course, you can always do veneers. If you're not happy with your smile and all the other things, then maybe the teeth are breaking apart. But if you have simple things like a little overlap, a little rotation, a little crowding, well, we don't want to have to touch natural teeth and grind them down if we don't have to. If you want something done in one day, then that's what you do. But in this case, you would talk about Invisalign. Invisalign is an orthodontic a way of removing teeth without regular braces and brackets, and it's a great way to just correct minor stuff like I said, slight overlap, slight crowding, and slight rotation of teeth, and put those teeth right back where they should be and get that beautiful smile back without really having to grind anything away.
So even just a couple teeth, people sometimes should think of doing orthodontic work, especially with the new way of doing Invisalign, where they don't have to wear the braces and the brackets and stuff. But how long? I mean, obviously there's no real time frame you can probably give, but something like light, does it always need to take years, or can it be something that's done in a few months?
Well, someone has a little crowding on the bottom teeth and a top tooth that's a little overlapped and rotated. It might only take 3 or 4 months to do something like that, maybe 6 months the most. No, it's not taking years to do this kind of stuff. It's a little blip in the person's life, and if they walk around every day looking in the mirror and just say, I just hate that tooth, and I hate that tooth, I hate that tooth, well, before you know it, that thing could be fixed already. Come on in and let's just take some mold, and we'll get some of the orthodontic Invisalign products, retrace in there, and before you know it, it's straight. And it can happen very quickly, and it's not an expensive ordeal.
And on top of it, if those Invisaligns are Invisalign, which you said they're really invisible at normal speaking distance, that means, yes, your tooth might be a little bit crooked, but nobody sees that you're even fixing it. So it was crooked before for years, probably. It's crooked now for another 6 months. Nobody sees that you really do anything. And next thing you know is they're not crooked.
You know how life goes so fast. 4, 5, 6 months, it's not a long time. And, you might not see people around every day or whatever. All of a sudden you see an old friend they haven't seen in 6 months. They go, something's different about you. Wait a minute. You did something. They don't know what it is. Is it the hair? Did you have a little dermabrasion? Oh, they have straight teeth all of a sudden. And it happens so quickly. So it's pretty exciting.
Wonderful. All right. So, some Invisalign treatment, orthodontic treatment, can replace, more expensive but faster, cosmetic dentistry like, veneers, and avoids the grinding down, keeps the tooth healthy. Because you said in another video, in another interview, that once you grind the tooth down, you just simply don't know how the tooth takes it. A little bit as kids, when we put I love you in a tree, I mean, some trees may take it, but some trees don't like to be cut, and then next thing you know is they die.
That's right. And then there's more dentistry that needs to be done, and nothing lasts forever, and then that's going to have to be redone. So it's always best that if you can, keep your natural teeth, unless there's problems with them, and put them in the position that you feel they should be or they used to be in. So, yes, let's keep our teeth and let's prevent further damage to tooth enamel if we can avoid it.
Thank you very much, Dr. Paskin.